A retinal vein occlusion, it's not technically a stroke in the eye, and it's caused by different things. Typically, it's caused by things like high blood pressure and diabetes. Even when those are well controlled, they can put you at risk for a vein occlusion. And rather than the artery being blocked, in a vein occlusion, it's the vein being occluded. And oftentimes that's because the artery is pressing down on it. There are certain risk factors such as glaucoma, but with a vein occlusion, rather than there being a complete stop of blood flow feeding the retina, you actually have a backup of blood from the vein system. So it's like you have a sink running and water's getting into the sink, but the drain is blocked, so the sink starts overflowing. A vein occlusion, we see multiple areas of bleeding in the retina, as well as fluid building up, like swelling within the retina itself. So it causes vision loss. It's not typically as severe as an artery occlusion vision loss, but it is still something that can lead to blindness and needs treatment. Unfortunately, there's no way that we know of that can completely clear up the vein occlusion, so we focus on treating the swelling and the leaking of vessels. So the treatment for that are injections in the eye of a medication that helps stabilize the vessels and prevent them from leaking, as well as treat the leakage. Sometimes vein occlusions lead to the arteries not being as well perfused because there's so much backup of pressure, in which case some patients can benefit from laser treatment as well to help reduce the need for oxygen to the retina. But it should be treated within a few weeks to a month, especially if there's swelling in the retina. We like to get that under control to help hopefully improve the vision as much as it can get better. Most of the time people have pretty good vision outcomes, although I will say that there are a subtype of vein occlusion that's what we call ischemic, where you lose a lot of blood flow and oxygen to the retina. And in those eyes, the vision prognosis isn't as good. For people with vein occlusions, oftentimes require injections on a monthly basis for their whole life. Sometimes we're able to stretch out that interval if they respond well to treatments. And there are a handful of patients that it gets better over time. There's also some patients where it gets worse over time. So it's really important that we follow these conditions carefully to see what group a specific patient falls into.